Healthy Living, brought to you by the Christ Hospital.
Well, heart failure is a complicated disease because patients come to heart failure in many different ways. And so you can't just approach heart failure in a linear fashion where you say A, then B, then C, then D. There are many forks in the road, there are many specialties and expertise that's required. So what you really need to do is build a program that has physicians, nurses, and ancillary providers such as exercise physiologists, nutritionists, and others to help take care of a heart failure patient. And we've done that over the years for the broad array of heart failure patients. However, there are more and more patients who develop what we call advanced heart failure. So to take care of these patients, we need to step up the game a little bit more. And that's what advanced heart failure care is. And it's particularly important now because of the advancement of technologies that allow us to do things for these patients that we could not really do previously. An example might be the left ventricular assist device, or the biventricular pacemaker, stem cell research, gene therapy research. Those kinds of advanced technologies are now available. Heart failure occurs in many, many, many different ways. In general, there are things you can control and things you can't control. So there are things you can control, like your lifestyle, smoking, watching your blood pressure, weight, exercise, diet, taking your medicines, avoiding bad medicines, communicating with the physicians. So those are things that you can do, that you have control over. Certain things you have no control over, your gender, your genetic makeup, those kinds of things. So I would say that focusing on the types of things you can control obviously are the things you can do. The most common reason for heart failure in this country are coronary artery disease and high blood pressure. So treating those two things goes back to the same story: eating right, exercising, not developing diabetes and hypertension, and those are things that you can do something about.
Call 513-206-1180 or visit thechristhospital.com.